Assalamualaikum and good day to everybody watching. Today I, Muhammad Irfan Amal bin Mahadi, Hazim bin Hawari, Abdul Hafiz bin Abdul Ghaffar from class 18 are going to talk about the topic of magnetic concept in magnetic resonance imaging. I am now going to introduce to you about MRI. Magnetic resonance imaging or MRI make use of protons which are plentiful in human body. All protons spin and generate a small magnetic charge. When a strong magnetic field, such as that found in a MRI machine, is introduced, the proton align with it. The MRI technician then applies a radio frequency pulse to the proton, disrupting it and forcing it into a 90-degree or 180 degrees alignment with the static magnetic field. Because the radio frequency pulse pushes the proton against their nature, when the pulse is removed, the proton realign with the magnetic field, releasing electromagnetic energy in the process. The MRI can detect this energy and differentiate between tissue based on how quickly they release it after the pulse is turned off. MRI isn't just a cool party trick, it is a revolutionary diagnostic tool. It aids doctors in the diagnosis of a wide range of medical conditions. MRI, unlike X-ray or CT scan, does not expose patients to a harmful radiation, making it a safer option in many situations. Now, I'm going to be talking about the magnetic concept in MRI. Let's look into the science behind the magic. Magnetism is at the core of MRI. Powerful magnets generate a strong magnetic field that aligns tiny spinning particles known as protons within atoms in the body. These protons act like a miniature magnet. A constant magnetic field, similar to tiny spinning magnets, align protons within atoms like hydrogen in tissues. This powerful field, which ranges from 1.5 to 3 Tesla, is thousands of times stronger than the magnetism of Earth. Then there are radio frequency, a specific RF wave pulse excites the protons, causing them to wobble briefly. The excited proton absorbs energy from the RF pulse, causing them to precise. This precession generates a tiny oscillating magnetic field, which is detected by the MRI scanner.
Assalamu alaikum and hi. I'm Abdul Hafiz bin Abdul Ghaffar and I'm going to talk about the real world applications of MRI. MRI isn't confined to a single act, it shines in diverse medical fields. One of those fields is neurology. High resolution anatomical scans show the brain's various structures, such as gray matter, white matter, and ventricles, in great detail. This aids in the detection of developmental anomalies, structural malformations, and neurodegenerative diseases such as Alzheimer's. Moving on, another application of MRI in neurology is locating tumors and stroke damage. Brain tumors frequently appear as abnormal contrast-enhanced lesions on MRI, allowing for early detection and characterization. This is important in guiding treatment decisions such as surgery or radiation therapy. Meanwhile, a stroke causes tissue damage, which appears as dark spots on MRI scans. Different patterns can distinguish between ischemic and hemorrhagic strokes, which is critical for appropriate management. Lastly, another application of MRI in neurology is mapping stroke damage and monitoring recovery. An MRI technique called DTI, which stands for diffusion tensor imaging, can assess the extent and direction of damage to white matter tracts after a stroke, helping predict potential functional deficits and guide rehabilitation. Furthermore, serial MRI scans can track the progress of stroke recovery, highlighting areas of improvement and potential complications. Okay, moving on to the application of MRI in orthopedics. In orthopedics, MRI can be applied to examine bones with detail. MRI can detect subtle fractures, stress fractures, and bone marrow abnormalities that X-rays may miss, assisting in treatment decisions. It can also visualize bone tumors and assess their extent and aggressiveness, which is critical for planning surgery and radiation therapy. Moving on, another usage of MRI in orthopedics is visualizing muscles and ligaments. Just like the picture shown, MRI provides detailed images of muscles, tendons, and ligaments, aiding in diagnosing tears, strains, and inflammation. This is particularly beneficial for sports injuries and conditions like arthritis. It can assess the alignment of joints and diagnose cartilage damage, helping plan interventions for joint pain and instability. Last of all, the field of oncology. MRI has become a mainstay in cancer diagnosis and management, offering valuable tools for early detection, characterization, and treatment monitoring. How? Firstly is detecting and characterizing tumors. MRI can effectively detect tumors in various organs, including the brain, breast, prostate, and liver. Its ability to differentiate between different tissue types helps distinguish between benign and malignant lesions. Advanced MRI techniques like spectroscopy can analyze the metabolic makeup of tissues, further aiding in tumor characterization and guiding treatment decisions. Second of all, monitoring treatment response and identifying reoccurrence. Serial MRI scans can track the response of tumors to treatment, showing whether they are shrinking, stabilizing, or growing. That's all from me. I will pass it to my friend Hazim bin
My
Hawari.
name is Hazim bin Hawari and I'm going to be talking about the benefit of MRI. There's two benefits. First is non-invasive and painless. MRI, unlike X-ray and CT scan, does not use ionizing radiation, making it safer for patients, particularly children and pregnant women. The procedure is also painless, requiring only a brief period of lying still inside the scanner. Second is 3D visualization and functional imaging. MRI provides detailed 3D image of the body, allowing doctors to visualize structure from various angles and identify abnormalities more accurately. Besides that, advanced MRI techniques like functional MRI can map brain activity in real time, helping understand neurological functions and diagnose neurological disorder. For the challenges, there is two. First is long scan times. Second is constrained application and limited accessibility. For long scan times, MRI scan can take anywhere from 30 minutes to several hours, depending on the body area being scanned and the imaging technique used, which can be uncomfortable for some patients, particularly those with claustrophobia. For constrained dilatation and limited access, because strong magnetic field can interfere with certain medical implants and devices, such as pacemakers and cochlear implants. MRI is not appropriate for all patients. Furthermore, for larger or obese patients, the narrow bow of some MRI scanner can be uncomfortable, if not impossible.
So now I'm going to tell you guys about the future development and innovation. The first is hyperfast scans. Using a compressed sensing technique, the MRI can capture only key data points and reconstruct stunning image in significantly less time. Aside from that, multi-channel coils capture more data, which speed up scans. Finally, parallel imaging can help you split the image into a smaller chunks and acquire them simultaneously, allowing you to fly through the scan. The second is AI power vision. AI will sharpen image, extract hidden insight, personalize scan, and even predict future health outcomes. AI algorithm can scour scan and tailor scan parameters and contrast agent to each patient's unique anatomy and disease risk, optimizing image quality and diagnosis, as well as detect and highlight subtle abnormalities for radiologists' attention. AI can predict disease risk by analyzing MRI data along with genetic and medical history, allowing for proactive intervention and personalized preventive care. So the last is portable MRI. Consider an MRI scanner rolling up to your bedside and being deployed in a disaster zone. This vision is become a reality thanks to miniaturization and new technologies. An advanced MRI should use new magnet design that are significantly more compact and mobile, such as permanent magnets or lighter weight superconducting material. Furthermore, wireless sensor and data transmission system simplify setup and allow the MRI scanner to roam.
For the conclusion, MRI has transformed medical imaging with its captivating combination of magnetism and radio wave. It enables us to see beneath the surface of things, to detect diseases early, and to develop personalized treatments. As research and innovation progress, the future of MRI promises even greater insight into the human body, paving the way for a healthier and brighter tomorrow. That is all. Thank you for watching.